Hello, how are you?
Hi.
My name is Corey. I'm going to be your nurse today. So I'm just going to ask you a couple questions here. So can you tell me what your name is?
Susan Davis.
Susan Davis. And how are you doing today, Ms. Davis?
I'm feeling a little bad.
How was the transport over here from the hospital?
It was a little rough.
Okay. Can you tell me your date of birth?
8/7/74.
Okay, perfect. And what's the main reason that you're here today?
I'm having stomach pain.
Okay. When's the last time you've had a bowel movement?
About 4 days ago.
Okay. Any gas? Are you passing any gas or?
Occasionally.
Now tell me, I was reading your chart. You're here for a fractured left femur. What happened?
I fell.
And how did you fall?
I was trying to skateboard.
Oh, okay. And how did that go for you?
Not very well.
I can see that. Okay. On your pain, what hurts more? Stomach, leg?
Right now, stomach.
Okay. What would you rate that on a scale of 0 to 10?
About a 7.
About a 7. And what about your leg?
About a 4.
Okay, about a 4. Okay, can you tell me a little bit about some brief history? You know, do you have any type of family history that I might need to be aware about?
Family history of diabetes,
Okay,
hypertension,
okay. Is it type 1 or type 2?
type 2.
Type 2. Okay. And I know this is your first night here, so we're trying to get you all comfortable. I got a water pitcher here for you. I'm going to give you your call light. If you need anything, you just press this button for me. We're going to come and do a focus assessment. Somebody will focus on your abdomen, try to figure out what's going on there, and then we'll have a focus assessment on your leg. Can I help you with anything at the moment?
No, thank you.
All right, thank you. Ms. Davis, how you doing? This is Corey, your nurse. I'm gonna wash my hands and I'm gonna put on my gloves. I'm gonna do a focus assessment of your abdomen. First, we're gonna start with inspection. So I'll just, if you don't mind, lift your shirt up. Her shirt is lifted up. So I'm gonna inspect for contour, symmetry. I'm gonna look at your umbilicus, and from inspection, I see that she has some general distension. Her umbilicus is midline and inverted. Her skin is even toned. Her respirations are even. Visible pulsations. Any generalized pain?
Yes.
Okay. Just everywhere, or is it in one certain spot?
This area right here.
Okay, your right lower quadrant. Okay. So now what I'm going to do is I'm going to go on to auscultation. All right, Ms. Davis, I'm going to auscultate your abdomen to hear your bowel sounds and to see if you're hypoactive or hyperactive. So I'm going to start with the right lower quadrant and make my way anti-clockwise, okay? Any pain, just let me know and I'll stop. So when you're auscultating, you want to listen for 1 minute, but if you hear diminished, less than 5 clicks, you're going to listen to up to 5 minutes. So we're just going to go around anti-clockwise, listening for 1 minute for each quadrant. And right now, by listening to her, I hear hypoactive bowel sounds because she's obviously constipated and she hasn't had a bowel movement in 4 days. So now I'm also going to, while I'm auscultating, I'm going to check for vascular sounds. And with that, you're going to use the bell instead of the diaphragm. So whenever I'm checking for bruits, I'm going to check over the aorta. No vascular sounds noted. Now I'm going to check for the venous hum over the epigastric region. No sounds noted. And then I'm also going to check for friction rubs over the spleen and the liver with the bell of my stethoscope. Okay, none noted. Now I'm going to switch over to percussion. Ms. Davis, so now we're going to go over to the percussion side of it. So I know you've had some abdominal pain. Can you point to that area again? Because we're going to leave it to last. To the right lower quadrant. Okay. So I'm going to start off with the right upper quadrant. I'm going to put 2 fingers down and I'm going to tap, and I'm looking for a sound. I'm looking for a tympanic sound. And that's good. That means you have some gas flowing in there. And I'm expecting some dullness over here, but let's get started. Any pain?
No.
Okay, now I'm gonna go to this area. If it hurts, tell me and I'll stop immediately, okay? Okay, so these 3 quadrants, I hear tympanic sounds, and then this one is dull, meaning that it doesn't have the gas present. All right, Ms. Davis, now I'm gonna percuss your liver to see the size of it. So I'm gonna start at the right MCL, over the 3rd intercostal space, and I'm gonna percuss down until I hear dullness. I'll make a mark. I'll start at the right MCL just above the umbilicus, and I'll go upwards. I'll make a mark once I hear dullness, and then I'll measure it. Should be between 6 and 12, okay? So I'll start right here. I'll percuss down, okay? I'm gonna make my first mark right here. Right here, percuss. I feel some dullness. Make my first mark. I'm gonna get my ruler. I'm gonna measure it. Okay, so you're at 8 centimeters, so you are definitely have an average liver. All right, Ms. Davis, now I'm gonna percuss your spleen. I'm gonna start at the 3rd to 4th intercostal space, slightly posterior to the left MAL. And I'm gonna percuss downward until dullness is heard, okay? If you have any pain, just let me know. And so I'm hearing tympany. Okay, I'm hearing some dullness right here, so I'm gonna stop. And the spleen is dull typically at the 9th through the 11th ribs of the left MAL. All right, Ms. Davis, now we're moving on to palpation. So there's light palpation and deep palpation. So basically, palpation is to assess the abdomen, and we want to also assess the organs, any masses or any tenderness. So I'm going to press my hand gently down and go at about 1 to 2 centimeters deep for the light palpation. I'm going to be looking for your facial expression, any pain. So you should have no tenderness. And also to be noted on this, whenever you're doing this, you should not palpate an organ transplant or a suspected Wilms tumor. So, because this is the area with abdominal pain, I'm going to do it last. So I'm going to start here. I'm going to go in a rotating motion. Any pain?
No.
Okay. I'm going to go right here in a rotating motion, 1 to 2 centimeters deep. Okay, now I'm going to go to the area where you've been having pain at. So if you're having any excruciating pain, just let me know, okay, and I'll stop.
Get off me.
Okay. So now I'm going to do deep palpation, and mind you, the reason I'm doing this is to assess the organs, the masses, and tenderness. So I'm going to get the tips of my fingers, and I'm going to go down 4 to 6 centimeters in a dipping motion. And if I find a mass or anything, I'm to note the size, location. Any pain?
No.
Okay. And I'm not gonna deep palpate the area that you're having pain at. Ms. Davis, now we're going to palpate the liver, the spleen, and the kidney. I will start with the liver. So whenever we're palpating the liver, I'm going to stick my left hand underneath your 11th and 12th ribs, and my right hand right underneath your right MCL. And I'm going to have you take a deep breath and come in, and while you're doing that, I'm going to palpate up and down, okay? So basically I'm checking for an enlarged liver, because an enlarged liver could indicate a tumor or cirrhosis. So now to check your spleen, I'm going to stay on the same side, the right hand side. I'm going to put my left hand I'm going to put it under your left CVA, and I'm going to take my right hand and I'm going to place it underneath the left costal margin. So typically whenever you're trying to palpate a spleen, you're not able to unless the patient is very, very skinny. So a non-palpable spleen is totally normal. All right, Ms. Davis, now the last thing I'm gonna do for you is I'm gonna palpate your kidney. So I'm gonna palpate your right kidney. I'm gonna place my right hand underneath your right CVA and my left hand on the right costal margin. And I'm gonna have you take a deep breath. Okay? Now, it's common to not be able to palpate the left or the right kidneys except in slender patients. So Ms. Davis, that is the end of our focus assessment on the abdomen. I will have somebody come in here and do a focus assessment on your skin and try to hope you feel better, okay?
Okay.
Okay, I'm gonna come in, wash my hands. Hi, Miss Davis, how are you doing? I'm gonna put on some gloves. I am just here, I'm Hannah, your nurse, and I'm here to do an inspection of skin on you, okay?
Yes.
We are gonna check quite a few things. We're actually gonna start at your head and move all the way down to your toes, okay? So when we start at the head, we're gonna be looking for any changes in color, pigmentation, any jaundice, any leathery of the skin. We're gonna inspect and just lightly palpate with the 3 fingertips as we go down on your skin, okay? We are gonna focus a little bit on your face, on the bridge of your nose, and then back behind your ears, as those are areas that are high concentration of skin cancer, okay? As we come on down, we're gonna come on down your skin, and then we're going to actually feel the skin using the back of our hands for the temperature of your skin. So we want that to be environmentally correct, okay? Since the rooms here is a little warm, your skin is a little warm, and that's okay. We're gonna check it for any moisture in the skin, and then also as we come on down, we're gonna be checking for any lesions, okay? So if we do find any lesions, we're gonna note the size of them, the pattern of them, and the location of them. Things that we can see would be freckles, any moles, any skin tags, any warts, any sign of infection such as rubella, or cold sores, ringworm, any inflammatory things such as scabies, which we may see in the back parts of the legs here behind the knees, or any thing like lice that would maybe up here at the top at the shafts of your hair, okay? So we're gonna continue looking for those as we come down, any bite marks from any insects, any allergies, contact dermatitis, eczema, as we come all the way down, any tumors. Okay, we'd also look into any of the folds in your skin, okay? And if it was somebody that was a little bit more overweight than you and they had folds in their abdomen or under their breast, we would then check those too to make sure that there's nothing in there. As we come down to your legs, we're going to continue to lightly palpate and visualize anything that we're feeling. Again, we would note the size of anything. And as we get down to your feet, we would actually separate your toes, looking in between them and the underside of your feet, making sure to fully assess your heels down here, as that is an area of pressure injury for most patients. Now, you've been laying in bed quite a bit due to your surgery of your fracture over here, so you're a little bit more at risk to have any pressure ulcers. So we would look for any of those. So we would just simply have you roll over here on your side, keeping that leg nice and straight. We would come down your back on any area where the bone would meet the bed, looking for those. If we had a spot that was red and unblanchable, that would be a stage 1. If we were able to see that the skin was not in contact anymore, that would be a stage 2. A stage 3 is if we saw any fat in any of those wounds, and a stage 4 is if we saw either bone, any muscle, or any tendons in that. If you happen to have an open sore that was full of eschar, so we were unable to actually see the extent of the damage, that would be an unstageable. Or if you had one that was black and purple or deep red in color, and the skin was still intact, that would be a deep tissue injury, which is not otherwise stageable. You do have a very clear looking back, which is great. I'm gonna help you roll back over here. I do notice that you have a surgical incision up here. It does have a little bit of redness to it, okay? So that's something that we're gonna wanna note. There's no drainage to this at the moment, but it is red. And you did mention that there was some pain in this hip over at that site. What's that pain level at this moment?
It's about a 4 right now.
Okay, good. Well, we'll definitely note that, and then we'll continue on with our assessment. Okay, so we're now gonna look at your nails down here. We're gonna look at them for any changes in the nail bed, the color of it. We're gonna make sure that they're smooth, that the thickness of them is okay, that there's no clubbing of the nails. Clubbing would indicate hypoxia. Yours look really good on that. We're gently gonna palpate them and make sure that they're firmly attached to the nail bed. And then also we're going to check the sides of them to make sure that the lateral and proximal folds are not swollen or tender at this time. We would then do the same thing on your toenails down here, and then check all of those for that too. We then need to check your hair. So with your hair, we are going to be looking, like I said, for any changes in it. We're gonna look and make sure that the hair itself is nice and smooth, that there is no decrease in hair from one side to the other, any baldness that's occurring at this time. We would gently pull on about 10 to 12 hairs and see if any come out. Now, losing 1 or 2 would not indicate an issue, but if several of them came out, then that could be an issue for us. Okay. Okay, Miss Davis, so we are going to then check the hair on your body. We'd start with the hair on your head, and we would gently palpate it while we are inspecting it. We want to make sure that there's no dullness of your hair and no hair loss, as those could indicate some issues. We would gently pull in about 10 to 12 strands, and if 1 or 2 of those came out, that would be fine, but we would want to make sure that we didn't have an excessive hair loss on that. We would also continue to check down for any excessive hair on the bodies that could indicate any endocrine issues, as we check the hair that is also on your arms, your legs, and your feet. Now, if you don't have any hair on your feet, that could indicate some issues with venous insufficiency, so we definitely want to check the toes down there for that hair. And then the last thing we really need to talk about is you inspecting your own skin. So Ms. Davis, it's very important for you to monitor your skin and any changes in your skin to decrease your chances of having cancer, especially skin cancer that's uncaught, okay? So there's an A, B, C, D, and E of the skin that we need to go over. When you find a new spot on your skin, you're gonna check it for symmetry. So if it's asymmetrical, meaning that one side is different than the other, that would be an issue. B, we're gonna look at the borders around that. Okay, so any of the moles or any of the lines that you have, you're gonna look around the borders. Are those borders same or are they different as they go? C, we're gonna see if there is a color change in these over time. So if the pigment changes as it goes across the mole or the lesion or whatever it is that we're looking at, that would indicate an issue. So D, diameter of it. So if you happen to have one that was on your leg or something that you could measure, you would measure that. If it's more than 6 millimeters, then you would want to look at that and have somebody else address that. And then E is evolution. So if this is changing over time, if there's anything new about it, if it's becoming painful, if it's bleeding, if it's scabbing up on you, if it's just growing, that would mean that it's evolving and we would want to have that looked at, okay? Now, do you have any questions?
No, ma'am.
Okay, well, as you go out in the summer and spend more time in the sun, make sure that you are covering that skin with anything that's going to help it, such as sunscreen or clothing or hat, okay? Decrease your chance.